Health promotion models in nursing practice. Nola Pender's health promotion model. The health promotion model is a predictive framework of nursing that aims to find out the major determinants of human health-related behavior, which is supposed to be preconditioned by the patient's individual experience and environment. Its ultimate goal is to reveal the potential for positive lifestyle changes in a patient. The elements that Nola Pender includes in her meta-paradigm form the picture of an individual as a holistic human being that uses their inborn qualities and characteristics to adjust to the changing environment to achieve harmony. However, although the person is understood as an independent, self-regulating force, the model emphasizes the significant role of the healthcare provider in promoting positive lifestyle changes. Therefore, the impact of the model on the advanced practice nurse's practice is hard to overestimate. They are supposed to provide complete, comprehensible, and accurate information to the patient to foster self-efficacy through the elevation of confidence in the patient's competence. The primary task of the practice is to help patients acquire enough skills, knowledge, and self-assurance to be able to care for themselves. Thus, the role of the advanced practice nurse expands from mere care provision to education of the patient based on the dynamics of their motivation formed by personal experience and environment. It implies that nurses can exert an influence on patients that would last for their whole lives if the desired outcome is achieved. Rosemary Rizzo Parse's theory of human becoming. Parse's theory is a transformative approach to all levels of nursing that regards the patient as the ultimate decision-maker in what concerns the ability of their body to promote health. The theory relies on three core principles: meaning, the ability to create personal meaning and set value priorities guided by life experiences; rhythmicity, co-creating rhythmical patterns with the environment; and transcendence, going beyond the limits of human potential. Thus, the theory of human becoming drastically transforms the advanced nursing practice and makes the profession stand out from the row of other disciplines. The theory relies upon the idea that the nurse should be able to take the patient's perspective and learn to be with the patient not only physically but also intellectually, emotionally, and socially, guiding them to the desired outcomes. The advanced nurse has to give up the idea of instructional nursing to fix the problem. The major goal is to find incongruence in the patient's and the nurse's health perspective and reach a compromise. It is not only about identifying what will best work for the patient but also about understanding what the patient thinks would work. As a result, the health patterns are not imposed but co-create in cooperation with the patient, which supports their dignity and freedom of choice. Pender's model in carrying out the AACN Essential 8. Carrying out AACN Essential 8 in daily practice can be assisted with the application of Pender's model as it allows. Articulating the advantages of cooperation of healthcare providers, patients, and their families. Demonstrating and delivering health information to multiple diverse audiences. Identifying opportunities for evidence-based clinical prevention of health conditions. Promoting culturally appropriate concepts of healthcare delivery. Advanced nurses are involved in an interprofessional practice that presupposes cooperation with other healthcare providers, professionals representing community services, education, public safety, environmental health, etc., patients, and their families. Thus, the application of the model will make it possible for them to protect the most vulnerable individuals and communities, reassuring them of their significance in health decisions and their impact on the functioning of the whole apparatus.